And today we get to start talking about clinical psychology. We're going to start off with therapeutic orientations. The book I use doesn't really do a lot of good work on therapeutic orientations, so I did supplement the little bit that they did have with a lot more information. It would seem that it's very rare to have a very robust lecture that does talk about this issue. So I hope this ends up working well. So I want you to think about movies or TV shows that depict therapy or the therapist-client interactions. Were they likely accurate or were they not accurate? Why is it important to have a basic understanding of psychotherapy? Until fairly recently, the portrayals of therapy or the therapist-client relationship in movies and television were usually focused on Freudian psychoanalysis, where people were in the chair, they were facing away from the therapist, and the therapist was sitting in the back, writing down their notes or whatever they're doing. And 95% of therapists are not going to do that. You are going to be probably sitting on a chair, couch, or whatever, and you're going to kind of be facing each other. I mean, you could maybe be looking at something else entirely, but generally you have the option to face the therapist, and they're probably going to be at least looking at you. And that is more typical. And a lot of the movies and TV shows, until fairly recently, were very much stigmatizing therapy, making it sound worse than it is, etc. They have been, in the past few years, has been a huge move to normalize going to therapy and showing a much more accurate portrayal. And a lot of people, wonder, why should we normalize it? The fact is about 80% of people who need therapy don't get it. They don't get any therapy at all. And that should really kind of frighten you. That only 1 in 5 people with a mental health condition do not go to therapy. So, getting a true understanding of what therapy is really like is really, really helpful. And it's very important to find out what type of therapy might be right for you and see what would go and gel well with your particular values. There are about 400 forms of therapy, and I'm not going to go through all of them because I'm certainly not an expert on that. But I've got a video that's going to discuss a little bit about some of the main forms of therapy and let you have a discussion and learn about enough of the difference so that if you choose to go to therapy, you will understand or think what type of therapist might gel well with your particular style. So I'm going to have this young doctoral student discuss it. A warning, she does have a mispronunciation of one of the words near the back. She'll say integrative, it is integrative, and that kind of really grates on me, but otherwise this is really about the best video I could find showing when what type of person might be best suited for different types of therapy. So I decided to put it in regardless.
Hi, my name is Anna. I'm a clinical psychology doctorate student, and I make videos about real-world applications to psychology. So in this video, I'm going to be talking about which type of therapy is right for you. So if you are considering therapy, it's kind of important to know what your therapist's theoretical orientation is, which basically means what their perspective is, what kinds of interventions they do, because this can be really important in finding a good match with a therapist, and it can just prolong you getting the help you need if you get into therapy and realize it's not for you and have to start over with someone new. So the first type of therapy is cognitive behavioral therapy, or CBT. This is the type of therapy that I tend to gear the most towards. What it means is basically in therapy, you're going to be focusing on cognitions, which is just kind of a fancy way of saying thoughts, behaviors, and also emotions, and how they're all interrelated and how they all influence each other. So this would be a good match for you if you're very solution focused and you want to see really concrete improvement. It would also be a good match for you if you are looking for something more short term, although not necessarily. There are a lot of CBT therapists that do it long term, but typically if you want something short term, CBT is going to be something really useful. It's also a good match if you want homework assignments on how to improve yourself, and if you just generally want a more directive therapist, someone to tell you kind of to your face what you need to do to improve. So if that's something that you don't really vibe with, then I wouldn't recommend CBT. CBT is also good if you want to learn things like grounding skills, coping skills, mindfulness, breathing, and relaxation exercises. So within CBT, there's something called DBT, or dialectical behavioral therapy. This is within CBT. It is behavioral, but it also has more of an emphasis on the role of the past and also self-acceptance. The dialectical component part comes from the balance of opposites, so change and also acceptance. They seem like kind of opposites, but in this therapy they are integrated. This is particularly good if you have a personality disorder, so a particular type of therapy was initially created by Marshall Linehan for borderline personality disorder, or if you just have borderline traits or tendencies, not necessarily the full-fledged disorder. So it's good for people who have difficulties communicating with others, very low distress tolerance, difficulties accepting themselves as a person, and emotional dysregulation. I should also mention that DBT is usually in the format of group therapy, so you have to be receptive to a group setting usually. You could probably find someone who teaches DBT in an individual therapy setting, but generally it happens in group therapy, so if that's not something you are open to, maybe this isn't the right therapy for you. The second main theoretical orientation is psychodynamic or psychoanalytic. This is the one people usually think of when they've just heard of psychology. Psychoanalysis was created by Freud, and psychodynamic theory is what Freud's followers are currently practicing. There's definitely more of a focus on the past, the unconscious, patterns in our lives. So this might be a good type of therapy for you if something happened in your past that continues to affect you today, something like childhood trauma, abuse, neglect. It could also be good if you want to deconstruct the defenses you put up, so things like denial, repression, projection. Those are all defense mechanisms, and there are a lot more, but if you feel like you're quite defensive psychologically, this might be a good way to work around that. If you're interested in dream interpretation, this could also be a good type of therapy for you, because it is, I think, the main one where you look at dreams and their content and what they mean for you. It's also good if you're interested in more of a long-term relationship with your therapist, because it tends to be kind of non-directive. There are some types of psychodynamic that are more directive, but generally it takes time before the therapist starts to plant seeds of ideas within therapy. And also it might be a good match for you if you're not afraid of exploring your relationship patterns and how they play out in the therapeutic relationship. This is called transference, where you are applying your relationship patterns that you usually talk about therapy, and you're actually projecting them onto your therapist. So if you don't want to talk about the therapeutic relationship with your therapist, if that makes you uncomfortable, then this might not be the right type of therapy for you. Systems is another theoretical orientation, and systems really functions under the assumption that people's psychological well-being is influenced by systemic forces. So things like their family dynamics, institutions, society, etc. So if you have dysfunctional family dynamics or you want family therapy, this could be a really good type of therapy for you, because they are really focused on different relationships between people. If you have dysfunctional couple dynamics or you want couples therapy, also this is a great type of therapy for that. If you see yourself as a victim of oppression, things like racism, sexism, homophobia, religious persecution, then this could be really good, because it really takes into account all those different forces on your well-being. And if you think your psychological issues are influenced by social or cultural forces pretty heavily. So for example, if your boss is a narcissist and the company you work at refuses to protect your well-being and this is causing you suffering, then something like systems might be useful, because it looks at how all these different forces in place have caused this relationship to happen. And lastly, humanistic existential is a theoretical orientation that focuses really on treating clients humanely and also exploring their existential crises. So if you want a therapist who will unconditionally accept you and validate you, this is definitely the therapy for you. Of course, ideally, this would be in all forms of therapy, but there's a particular focus on it in humanistic existentialism. It's also good for you if you want to explore existential questions. So, for example, what happiness and health looks like for you, what an actualized life would mean for you, what fulfillment means. This might also be a good match for you if you don't want to be pathologized. So if you've ever, for example, been called non-adherent for refusing medications for something like psychosis, a humanistic existential therapist probably is not going to pathologize you for that. Also, if you're not so much focused on fast, concrete change as you are on exploring your worldview and exploring yourself, this might be a good match for you. And if you want to explore the spiritual or the supernatural, this is a great therapy for that. It really takes into account people's ideologies, the role of their faith or lack thereof, and things like belief in the supernatural. So for example, if you have what people refer to as hallucinations, and for you just consider they're demons, this might be a great therapy for you because it wouldn't really pathologize that. So lastly, I just want to talk a bit about the difference between eclectic and integrative theoretical orientation. So if you come across a therapist and you ask, what's your theoretical orientation? And they say, I'm eclectic, that's not usually a great sign. Usually means it's kind of a hodgepodge of techniques. You're not really sure which interventions you should use when, and that can leave clients really confused. It can also be not very effective, sometimes even make the situation worse for people. Integrative, on the other hand, you have a very clear picture of what type of therapy you use when, and which assumptions underlying those therapies you agree or disagree with. So for example, you can say that you are integrative and that you use CBT interventions, but you acknowledge the role of the past and you believe people use defense mechanisms. You could also say you use a foundation of systems beliefs, but you treat your clients with the validating, accepting nature of humanistic existentialism. So really, no matter what a therapist says, if they say eclectic or if they say integrative, you should really kind of probe on that and ask them, well, what do you mean by that? Which specific aspects of which types of therapy do you implement? And how do you combine these? And do you combine only 2 of these or do you combine 4 of these? And that can be really good in seeing if these therapists have a clear picture of their theoretical orientation or if they're just kind of using a hodgepodge of everything. So I hope this was helpful. Let me know in the comments if you have any other questions or if you have any other topics that you want me to cover. And please remember to hit like and subscribe if you like real-world applications to psychology. See you next time.
Okay, so yeah, she at least put on a thing saying that she mispronounced integrative. I don't know where she's from. All right. So I think she did a pretty good job of going through all of those, or several main families of therapy, and deciding which one you want to do or not. So you can, if any of these sound cool to you and you decide you want to go into therapy, I would suggest going to Psychology Today, exploring whichever one she said that interests you, and seeing who is in your area that practices it. There are many different families of therapeutic orientation. Here are a few of them: psychoanalysis, humanistic, CBT, and mindfulness. There are, of course, many, many additional ones, but these are a few that we're going to be discussing. Also, later on in this lecture, I do have a few others that don't fit into these particular family groups. So the first one is psychoanalysis. I dare say that most people are probably relatively familiar with this, at least how it is portrayed. Anytime you're seeing a person who's sitting in a couch, pointing the other directions from the therapist who's sitting in the back, you're probably looking at someone who's trying to replicate psychoanalysis. This whole stereotype of somebody laying on basically what amounts to a fainting couch, basically, comes out from the fact that Freud, who was very, very embarrassed and very, very shy, so he didn't want to look at the ladies who were coming in for therapy. So that's where that stereotype comes from. Interestingly enough, Freud was actually not a psychologist, nor actually was he a psychiatrist. So he actually had a job that realistically doesn't exist anymore, to be quite honest. I had some relatives that were the same job he had. It was actually this understanding, the understanding of this job is that it's a doctor of nervous disorders, which is neither a neurologist nor a psychologist. Those are still completely different jobs. Anytime you try to find, or in a situation where you're in um, a standardized test where they discussed Freud, it's kind of hard to know what they're going to say is the correct answer when, if they say which one of these things is he, because again, his real job never really existed. On a positive note, he did organize this first therapy, and unfortunately, it has been pretty severely discredited, but we are told we have to discuss it anyway. But psychoanalysis, psychodynamic, it's not really great anymore. He also did stuff like created false memories. It was pretty bad. Structural model is that you basically have these three sections: the id, the ego, and the superego. Each one of those has a little bit different function in this environment, including the id's mostly, it's not really thinking, it's mostly just going after the pleasure. You got the superego ego, who really does morals, judgment, etc. And then this ego, which kind of runs between the two. There is really no evidence to suggest that this model is correct, but we still discuss it and we still teach it because it's part of the history. So it has the techniques that are used in psychoanalysis, part of which include stuff like free association. That's when you say one thing and the next person responds to what's the first thing that comes up in their mind. So I say blue, you say red. I say green, you say grass, or whatever it happens to be. And the idea behind this is that you can use this free association to get more information about what is driving them, the subconscious. You know, they also really like discussing stuff like childhood relationships, and that ends up being problematic. Freud at one point was also a hypnotist as well, and some things I think he adopted from hypnosis and basically tried to use it in a way that it really shouldn't have been used. And he was very, very guilty of putting in false abuse memories in many of his female patients. And, well, that really wasn't great. He also was very into dream analysis, as well as transference and countertransference. Transference is basically when you're putting your views onto the therapist, and countertransference is basically when the therapist is doing the same thing to you. It certainly has a lot of limitations. They would say severe psychopathology is a limitation. Realistically, concerning doesn't work very well. I would dare say any psychopathology is probably not a great idea. Mental retardations or having intellectual disabilities, that doesn't work very well either. Perhaps that's because they never tried, or just because there's really no evidence for it anyway. It is incredibly expensive. Even those people that are still doing it now, you're looking at spending potentially several years in therapy, and that gets very, very pricey very, very quickly. And as I mentioned, there really is not very much empirical evidence supporting psychoanalysis or psychodynamic theory. So let's discuss our joke, which is a psychoanalysis joke. A psychiatrist was conducting a group therapy session with 4 mothers and their young children. "You all have obsessions," he observed. To the first mother, Mary, he said, "You are obsessed with eating. You've even named your daughter Candy." He turned to the second mother, Anne, "And your obsession is with money. Again, it manifests itself in your child's name, Penny." He turns to the third mom, Joyce. "Your obsession is alcohol. This too shows itself in your child's name, Brandy." At this point, the fourth mother, Kathy, quietly got up, took a little boy by the hand, and whispered, "Come on, Dick. This guy has no fucking clue what he's talking about." Ba-dum-bump. So now it comes down to humanistic and person-centered therapy. And basically everything here comes down to the source of pathology actually has a lot to do with an inconsistency between the patient's behavior and their true personal identity. So let's say there's a person who's transgender and who's very, very depressed and anxious. Maybe they have to wear dresses and they don't feel appropriate, in the dresses or something along those lines. So basically what they would say is if they were forced to wear dresses, that their depression comes between that inconsistency because they would rather not. That's what the whole thing with him is. So the source of pathology can usually be rectified. All you have to do is be consistent with yourself. Goals of this thing is really to discover, yourself, discover your self-worth, explore yourself, alter your behavior to reflect your identity. Everything comes down to what your identity is and the behaviors that you can make to make it better. The owner is, the creator here is Carl Rogers, and we're going to show some clips from with him working on a patient in just a second. Some of the techniques that he does further this is that the techniques of the therapists that are using humanistic therapy is that they're really, really not very directive and that they have unconditional positive regard. So what they mean by non-directive is maybe you're going off and you would like some advice. These people, not really going to give it to you. I mean, the difference between having going to therapy with one of these people and going to have use a friend as a sounding board is that your friend probably will give you some advice. They're really not big into that. But like a good friend, hopefully, first of all, hopefully your friend likes you. That's what this whole unconditional positive regard. We think well of you regardless of what you say, regardless of what you do. Basically like a good friend. Just, unfortunately, there's absolutely no direction in this. So I'm going to show you an example of how he does a little bit of work with a patient. This is an example therapy. We will see the patient again with a different person in a few minutes.
If I have any success in creating the kind of conditions that I described initially, then we may be able to see. If I have any success in creating the kind of conditions that I described initially, then we may be able to see some of these changes in this client, even though I know in advance that our contact is going to be very brief. Good morning.
Hello, Dr.
I'm Dr. Rogers. You must be Gloria.
Yes, I am.
Let's have this chair. Well, now, we have half an hour together, and I really don't know what we'll be able to make of it, but I hope we can make something of it. I'd be glad to know whatever concerns you?
Well, right now I'm nervous, but I feel more comfortable the way you're talking in a low voice, and I don't feel like you'll be so harsh on me. But,
I hear the tremor in your voice, so you are uneasy.
well, the main thing I want to talk to you about is I'm just newly divorced, and I had gone in therapy before, and I felt comfortable when I left, and all of a sudden now the biggest change is adjusting to my single life. And one of the things that bother me the most is especially men and having men to the house and how it affects the children. And the biggest thing the thing that keeps coming to my mind I want to tell you about is I have a daughter 9 who at one time I felt I had a lot of emotional problems. I wish I could stop shaking. And I'm real conscious of things affecting her. I don't want her to get upset. I don't want to shock her. I want so bad for her to accept me. And we're real open with each other, especially about sex. And the other day she saw a girl that was single but pregnant, and she asked me all about, can girls get pregnant if they're single? And the conversation was fine, and I wasn't at ease at all with her until she asked me if I'd ever made love to a man since I've left her daddy. And I lied to her. And ever since that, it keeps coming up to my mind because I feel so guilty lying to her because I never lie and I want her to trust me. And I almost want an answer from you. I want you to tell me if it will affect her wrong if I told her the truth or what.
And it's this concern about her and the fact that you really aren't, that this open relationship that has existed between you now you feel is kind of
Yes, I feel like I have
damaged.
to be on guard about that because I remember when I was a little girl, when I first found out my mother and father made love, it was dirty and terrible, and I didn't like her anymore for a while. And I don't want to lie to Pammy either, and I don't know.
And you sure wish I could give you the answer as to what you should tell her.
I was afraid you were going to say that.
Because what you really want is an answer.
I want to especially know if it would affect her, if I was completely honest and open with her, or if it would affect her because I lied. I feel like it's bound to make a strain because I lied to her.
Sort of
This
feel
is the
she'll
biggest thing.
suspect that, or she will know something's not quite
I
right
feel
in
that
the
inside she'll
relationship.
distrust me, yes. And also I thought, well, gee, what about when she gets a little older and she finds herself in touchy situations? She probably wouldn't want to admit it to me because she thinks I'm so good and so sweet. And yet I'm afraid she could think I'm really a devil. And I want so bad for her to accept me. And I don't know how much a 9-year-old can take.
And really, both alternatives concern you, that she might think you're too good or better than you really are,
Yes.
and she might think that you're worse than you are.
Not worse than I am. I don't know if she can accept me the way I am. I think I paint a picture that I'm all sweet and motherly, and I'm a little ashamed of my shady side, too.
I see. It really cuts a little deeper. If she really knew you, could she accept you?
This is what I don't know, yes. I don't want her to turn away from me.
That
And I don't
relationship-
even know how I feel about it, because there are times when I feel so guilty, like when I have a man over. I even try to make a special setup so that if I were ever alone with him, the children would never catch me and that sort of thing. Because I'm real leery about it. And yet I also know I have these desires.
So it's quite clear, it isn't only her problem or the relationship with her, it's in you as well.
And my guilt, yeah. Yeah, I feel guilty so often.
What can I accept myself as doing? And,
Yes, yes.
And you realize that you set up sort of subterfuges so as to make sure that you're not caught or something. You realize that you are acting from guilt, is that?
Yes. I don't like the way, I would like to feel comfortable with whatever I do. If I choose not to tell Pammy the truth, to feel comfortable that she can't handle it, and I don't. I want to be honest, and yet I feel there are some areas that I don't even accept.
And if you can't accept them in yourself, how could you possibly be comfortable in telling them to her?
Right.
And yet, as you say, you do have these desires and you do have your feelings, but you don't feel good about them.
Right. And I have a feeling you're just going to sit there and let me stew in it, and I want more. I want you to help me get rid of my guilt feeling. If I can get rid of my guilt feeling about lying or going to bed with a single man, any of that, just so I can feel more comfortable.
And I guess I'd like to say, no, I don't want to let you just stew in your feelings, but on the other hand, I also feel that this is the kind of very private thing that I couldn't possibly answer for you, but I sure as anything will try to help you work toward your own answer. I don't know whether that makes any sense to you, but I mean it.
Well, I appreciate you saying that. You sound like you mean it. But I don't know where to go. I don't begin to know where to go. I thought that I'd pretty well worked over most of my guilt, and now that this is coming up, I'm disappointed in myself. I really am. I like it when I feel that no matter what I do, even if it's against my own morals or my upbringing, that I can still feel good about me. And now I don't. Like, there's a girl at work who sort of mothers me, and I think she thinks I'm all sweet, and I sure don't want to show my more ornery, devilish side with her. I want to be sweet, and it's so hard for me to, this all seems so new again, and it's so disappointing.
Yeah, I get the disappointment that here, a lot of these things you thought you'd worked through, and now the guilt and a feeling that only a part of you is acceptable to anybody else.
Yes.
That keeps coming out. I guess I do catch the real deep puzzlement that you feel as to what the hell shall I do? What can I do?
Yes, and you know what I can find, Doctor, is that everything I start to do, impulse, it seems natural to tell Pammy or to go out on a date or something. I'm comfortable until I think how I was affected as a child. And the minute that comes up, then I'm all haywire. Like, I want to be a good mother so bad, and I feel like I am a good mother. But then there's those little exceptions, like my guilt's with working. I want to work, and it's so fun having extra money. I like to work nights. The minute I think I'm not being real good to the children or giving them enough time, then I start feeling guilty again. Then that's when it's a, what do they call it? A double bind. That's just what it feels like. I want to do this, and it feels right, but after all, I'm not being a good mother, and I want to be both. I'm becoming more and more aware of what a perfectionist I am. That's what it seems like. I want to be so perfect. Either I want to become perfect in my standards or not have that need anymore.
Or I guess I hear it a little differently, that what you want is to seem perfect. That it means it's a matter of great importance to you to be a good mother, and you want to seem to be a good mother even if some of your actual feelings differ from that. Does that catch you?
Yeah, I don't feel like I'm saying that. No, that isn't what I feel, really.
Okay.
I want to approve of me always, but my actions won't let me. I want to approve of me. I think...
I realize you, all right, but because I'd like to understand that. You sound as though your actions are kind of outside of you. You want to approve of you, but what you do somehow won't let you approve of yourself.
Right. Like, I feel that I could approve of myself regarding, for example, my sex life. This is the big thing. If I really fell in love with a man and I respected him and I adored him, I don't think I'd feel so guilty going to bed with him, and I don't think I'd have to make up any excuses to the children because they could see my natural caring for him.
Okay.
But when I have the physical desire and I'll say, oh, well, why not, and I want to anyway, then I feel guilty afterwards. I hate facing the kids, I don't like looking at myself, and I rarely enjoy it. And this is what I mean. If the circumstances would be different, I don't think I'd feel so guilty because I'd feel right about it.
Yeah, I guess I hear you saying if what I was doing when I went to bed with a man was really genuine and full of love and respect and so on, I wouldn't feel guilty in relation to Pam. I wouldn't, I really would be comfortable about the situation.
That's how I feel, yes. And I know that sounds like I want a perfect situation, but that is how I feel. And in the meantime, I can't stop these desires. I've tried that also. I've tried saying, okay, I don't like myself when I do that, so I won't do it anymore. But then I resent the children. I think, why should they stop me from doing what I want?
And that's, he actually does go on with this woman, and they don't get anywhere, to be honest with you. This honestly would drive me crazy, and I think this would drive a lot of people crazy. You can actually hear her get a little bit flustered. But don't worry, there are other techniques too. But before we go on to those other techniques, we do actually, I guess, have to finish up with this one. And there are some advantages to this. First of all, it is acceptable to a lot of patients. A lot of people are not scared of this approach. And that unconditional positive regard does show up in other forms of therapy. Really, it should show up in all forms of therapy. These guys just really have a major focus on that. And as far as disadvantages, well, sometimes it's effective and sometimes it's not. There's no evidence suggesting unequivocally that this actually does work. And as you can see, some people might get a little bit annoyed by how these people do act. So another one here, as far as therapies, is CBT, cognitive behavioral therapy. This is, at least in the US and in several other countries, is one of the main, most common therapies out there. Basically, everything comes down to how your thoughts, behaviors, and emotion all interplay with each other. And it works with a variety of conditions. And the real thing is that if you can influence your thoughts, you can change your behaviors and your emotion. If you change your emotion, you can affect both of them. Basically, it does work together in this triangle here. It is very focused in the here and now. It has a lot of scientific evidence suggesting that this is a good theory, that this is a good therapy, very, very evidence-based. And in comparison to some of the other therapies, it's relatively short. You might only have 8 to 10 therapy sessions. You can do a lot of work with that amount of sessions. You might not be perfect, but it's certainly a fair amount of work can be done. Of course, there are people that will see their therapist for years too. And now we've got an example of seeing that in action. Yes, you're seeing Gloria again.
Because if you really are defining yourself in terms of others' estimation of you, then even when you're ahead of the game and you're winning them, you have to be saying to yourself, will I win them today? Will I win them tomorrow? Will I keep? Because if you really are defining yourself in terms of others' estimation of you, then even when you're ahead of the game and you're winning them, you have to be saying to yourself, will I win them today? Will I win them tomorrow? Will I keep winning them? And you're always focused on, am I doing the thing to please him? And you never are yourself. You never have a self. While if you're saying, what do I want to do in life? There must be some human beings who would like me the way I am. Let's see if this is one of those human beings. Then that's the only way, isn't it, that you can be. You see?
Yeah.
Now, we haven't got too much time now, so let's try to get it off on a constructive note of more concretely what you can do. You asked before where you can go, how you can meet new people. I'd say that I don't know this particular area, but it's almost any place. If you could do what we are talking about, really take risks and focus on what you want out of life, and on the fact that it's going to take time, which unfortunately it does, and it is not awful, and you're not awful while it's taking that time, then you can leave yourself open unshyly to all kinds of new encounters. And these encounters can take place on buses, while waiting for a streetcar, if they have streetcars in this area, at cocktail parties, anywhere. You can talk to people who look eligible. You can ask your friends to get you eligible males and so on. But the main thing is that you have to, A, like yourself while you're not doing badly, and B, not be intolerant against conditions which are bad. And I'm agreeing with you that they are. Now, as I said, I would give you, if you were a patient of mine, the homework assignment of deliberately, very deliberately going out and getting yourself into trouble. In other words, taking the most eligible males you can find at the moment and forcing yourself, risking yourself to be you.
Are you saying even if it were like if I went into a doctor's office to start a conversation with him because he was attractive to me or he appealed to me?
Right.
I'd even go so far as to starting out a conversation with him, a personal one?
Why not? If he's an eligible individual, any kind of an eligible individual.
Well, I feel you accept that, but that seems awfully brazen or something.
Well, let's suppose it is brazen. What have you got to lose? The worst he can do is reject you, and you don't have to reject you if you were thinking along the lines that we've been 25 minutes or so. You see?
Oh, yeah.
Now, can you try to do that?
I think so. It sort of gives me a spurt to go out and...
So that is a very, very different approach than the humanistic approach that we also just saw. You saw he actually was giving some suggestions. And in this case, go get yourself into a little bit of trouble and giving homework. And that is much more typical of CBT. This whole concept of CBT really comes down to this idea of having automatic thoughts. All of us have this schema that we've built up over this world, this model, this understanding of how we think the world is, how we think ourselves are, and how the future is. And sometimes these automatic thoughts are not the best thoughts to have. Sometimes they do need to be modified, at least somewhat. Maybe the idea of how we are as far as ourselves isn't 100% accurate, and we need to change some things. Maybe the world isn't 100% accurate. Maybe our future just, well, we can always fix that. But we don't know unless we basically try to modify the underlying ideas behind these automatic thoughts. And we do this by a couple of different techniques. One of them is this concept of cognitive restructuring. Basically, we're telling the brain how to rethink these thoughts. You can also do things such as exposure therapy, that does fall under CBT. And in exposure therapy, we find out what we're kind of freaked out about, and what we do is we modify a situation so that it's in a situation where we know that it's there, and we just eventually relax enough and get used to the situation. And it's this understanding of, we've all seen this with phobias. Maybe if you're scared of a bug, we find that there's a photo of a bug across the room, or maybe a real bug, who knows, whichever the bug it is. And it gets slower, you get more used to it. Eventually, you're possibly holding the bug, which, if you want to do that, that's fine. If not, well, that's just one of the ways that you can do exposure therapy. You can also do flooding, which is also related as well. It's basically exposure therapy on steroids. There are a lot of advantages for CBT. It is relatively brief. We have a lot of different ways we can describe brief, but in comparison to several other options, it is relatively brief. It is scientifically proven, but the disadvantage is that the patients have to work. They have potentially homework. If you don't want homework, this is probably not the one for you. So you might want to find a different answer. Other options include various forms of mindfulness training. Mindfulness is something that has been around for many, many years, but is only really starting to get into, I don't want to say the Western world, but the 20th and 21st century is when we started seeing that show up more commonly. Things like yoga are all related to these types of things. Meditation, that's where you get into all of this. If you want to learn more about mindfulness, there are a few professional organizations out there that specialize in teaching therapists this information and how to use these types of techniques. Unfortunately, none of them are currently in the state in which I am residing. So the things about mindfulness and this type of thing, you're really learning ways to focus your attention. If you've ever heard somebody say, think of 5 things you can see, 2 things you can, 4 things you can hear, going down and down, that's basically just focusing your attention. It's very much oriented towards that present moment, assuming you have a thought that approaches into your head. Maybe it's unwanted. You just sit there, acknowledge it, and acknowledge that you had it, and kick it out. There are, of course, other techniques that pop in, DBT that mostly works with people with borderline, and acceptance and commitment therapy that crosses over here. DBT is basically a mixture of this one as well and basically CBT. The acceptance and mindfulness-based approaches, we do have some advantages. A lot of people, especially nowadays, are considering it completely acceptable things. This is as meditation and mindfulness and all those and yoga are all basically becoming mainstream. Several years ago, this wouldn't have been considered acceptable. Accessibility, even if you're not with a therapist who focuses on mindfulness-based practices, the odds are good you know somebody who does something like yoga or meditation. So you can probably learn nowadays. The disadvantage is that it's limited efficiency. So is it effective? Who knows? The problem is that we don't really have a lot of research currently on it. There are people out there that are doing work. It just hasn't been working as well as one would hope. There are a lot of other therapeutic orientations as well. That includes stuff like solution-focused brief therapy. And this whole one really focuses on finding solutions to whatever your issues are. Really focuses on really what is called the miracle question, which is when you wake up tomorrow, what will be different that will tell you that a miracle has happened and the problem which brought you here is solved. And usually when people think of this, they do give us the underlying answer as to what we really are needing to fix. So, I'll know that that I'm now considered more acceptable, or I've got someone that really loves me in my life. Well, now we know it's really trying love. It's not necessarily the depression. It's not necessarily the anxiety that they have. It's more of, okay, well, they need to get out and meet people. Another real focus in this is that you are presupposing change. So let's say that you have an issue and you know that this day was it was a really, really bad day. So somebody might say, okay, so you had a rough day. So wow, so what stopped a complete disaster from occurring? Because this makes the assumption that it could, first of all, that's you did something to make it at least a little bit better, or at least prevent you from having a complete disaster. The exception questions are huge. So this is actually one of the reasons I really like solution-focused therapy. Is it's very, very similar in some ways to when you are going into medicine. They always say, well, what makes things better or worse? So that is kind of with this concept of an exception question. So you come in for somebody who's depressed. Okay, so when are you not depressed? Coming in for angry. Well, when are you not angry? So we're really looking for those exceptions, and you're trying to take this and have more exceptions, basically. Scaling questions, scale of 1 to 10, with 10 representing the best it can be and 1 the worst. Where would you say you are today? And then once they give you a number, because this is just like the pain scale, well, so what made it a 4 and not a 5? That would be a question you could have. So once you get that information, you can get more and more narrow. And another thing is you can say, how have they managed so far? So somebody has a really, really disastrous situation. Well, that's horrible. How have you managed to make it as far as you've managed? And then sometimes you'll get stuff like resources or whatnot, and ways that you can really play with the and help them find a solution for this. Another one is kind of related to solution-focused therapy. It's called Possibility Therapy, and this was focused on by Bill Hanlon, and I know him. He's a really nice guy. He used to call this solution-oriented therapy. Unfortunately, he got confused with solution-focused so often. It was ridiculous. And there are some differences between solution-focused and possibility, and a lot of people tend to go a little bit more towards him because not the solution-focused people don't always acknowledge that there was a problem, or they're considered to be too optimistic. Bill's possibility therapy acknowledges that there was a problem at the very least. So you have to validate what the client is saying, and then it will tend to be a little bit better. You'll also build some more rapport with them. It's okay for you to say, oh, I've had a similar situation. I completely understand. He tends to discuss some of his issues that happened as a child for him, especially when certain things come up, and apparently it makes his clients feel better, which I can totally believe. He was an absolutely remarkable therapist. Now, in possibility therapy, you're still reframing how clients see things. So instead of people looking at, let's say, COVID is a horrible situation, and COVID is horrible. We have over 500,000 people dead in the U.S. We're approaching 600,000, and it's had a huge disruption in how we're living our life. But in this case, you'd reframe how clients see things. For example, I've actually been more productive now than I've been my entire life. If it wasn't for COVID, my husband would have been would actually probably be dead right now. And so in this situation, if I didn't have all my conferences canceled at the last minute, and luckily, just as my husband had come down because he lived in North Carolina, he came down, and then 2 days later we all went on lockdown. All my conferences got canceled. And then he started to develop some health problems. And if I was gone, I may not have caught them. I may have been too stressed out. And it turned out that he was an undiagnosed diabetic. By the time we got him into the ER, he had a blood glucose of 1443. 100 is normal. So every time somebody says about how horrible COVID is, I remember the fact that I saved my husband's life. If it wasn't for COVID, he'd be gone. I also look at my productivity, not having to drive 3 hours a day. I easily could reframe COVID as being as great as it is. I mean, it's not great, but certainly I'm looking at it as a lot of good things that came out as far as personal stuff. Bill's therapy also really is looking into any resources, expertise, or experiences that client might have that might be able to help improve the solution of anything of their problem. And that is really the biggest factor. Bill Hanlon was heavily influenced by Milton Erickson, who also did a lot of that resources and such like that. And it's an incredible therapy technique. The man's written 42 books, several of which has been on his form of therapy. He's also been on Oprah. If you want to learn more about him, he's got his website right here. The guy is incredible. There are also other therapies. There's the expressive therapies family, and that can include stuff like art therapy, drama therapy, and music therapy. Each one of these does have its own separate organization. I know the most about drama therapy. That's also called theater therapy, and that is used very heavily for people with disabilities, and it's incredibly good with people that have autism spectrum disorders. I don't know as much about the others, but if you wanted to learn more, there's a lot of good stuff out there about these. So if you're also artsy and like psychology, you might want to consider getting into one of these expressive therapies as well. So here's your discussion questions. Which therapeutic orientation would you want your practitioners to practice? Why? What might psychotherapy look like 100 years from now? What should be considered when choosing the right therapist for a patient? Is it more important for a therapist to be supportive and have a good bedside manner, or their orientation, which might not necessarily be overly friendly? Scott Miller's work suggests most therapeutic orientations are similar, and sometimes psychics are even more effective. Why seek a therapist instead of a pastor or even a psychic? Were these media portrayals or whatnot positive or negative? How and in what way? What are some stigmas that tend to be associated with psychological treatment? If someone you knew were to seek treatment for social anxiety, do you think they would feel comfortable sharing this information? Why or why not? As always, if you have any questions, please feel free to drop me an email, send me a comment, whatever works best for you. Thank you and have a great day.